patients often say that they don't feel hungry while on this medication, and they ask, why am I not hungry on Mounjaro, and should I force myself to eat?
Don't force yourself to eat. I would go against that. However, as we've mentioned before, it is important to cover all the nutrients and to make sure you're healthy and strong on this journey. So no, don't force yourself.
Yeah.
Don't push through anything that you don't think it feels right. However, it is important to have some kind of structure and sit down at meal times and think, okay, I need to nourish my body. Sometimes that is difficult if appetite suppression is quite strong. So we need to make sure we find the right balance. The day of the injection and probably the day after, nausea can kick in.
Yeah.
It's quite normal that you feel a really strong suppression. However, if it goes farther than that, if you feel like that for the whole week and you're struggling to eat, we definitely need to change that. Probably the patient is in a very high dose and we need to adapt a little bit the treatment.
Yeah.
We need to be able to eat and we need to be able to experience hunger and appetite to a certain extent. The medication will work in a way that is suppressing your appetite,
Yeah.
and it will be easier to maintain and control cravings and appetite, but not to the extent that you're not able to eat for a very long
Yeah.
period of time. So 1 or 2 days is fine, and on those occasions we still need to function and we need to eat to be healthy and strong. So it's important to sit down and think, okay, what can I eat that I don't think is going to be too hard for me
Yep.
to digest. So things like, for example, a little bit of yogurt with fruit and nuts, or maybe a protein shake. It wouldn't be my ideal or first option when it comes to protein, but in these cases is probably a really nice supplement to adding a little bit of extra nutrients. So something that you know is going to have lots of nutrients, very nutritious, but it's not going to be really heavy and is going to be easy to digest.
And just feels a little bit lighter, because I think a lot of patients, they maybe just feel overwhelmed when they maybe look at their typical meal and they probably feel that I don't think I can eat this, and they'd rather just skip that altogether. So this is a good alternative for them to maybe consider having.